basically our second monthly webinar for the Boxwood Alliance. And our goal is to educate people about services and information available to our aging seniors. We collect information and we do try to post things on our website, both as far as resources and information. The Boxwood Alliance is a 501c3 nonprofit aging in place organization, and we encourage participants to remain active and independent in their communities. And when they need help, the Boxwood Alliance and the website provides connections to resource tools and research-based programs that can help older adults remain confident and in the community that they love. We do accept volunteers, so if people think that this is a great service and they want to join us and volunteer to work with us, we are all volunteers here in this organization. Nobody's paid. Everybody's giving their time free, and basically that's what the Boxwood Alliance does. So, Stacey, we're going to hand it over to Stacey, and we're going to let everybody do their own intros. And
hi, everybody. I'm so glad you're all here. My name is Stacey Rosenbluth. I'm from the Alzheimer's Association of the Hudson Valley, and my role is care consultant and family education director. So a lot of what I do is programs like we're going to listen to today, but also I meet with families either one-on-one or as a family for really whatever assistance anyone needs from A to Z on their journey in Alzheimer's or other dementias. I meet with people free of charge. You just call our 800 number and they'll get you to me or my colleague in Westchester. We're local, and we help you out with resources or wherever you're struggling. As we get into the program, I'll post in the chat my contact information and our 800 number and my email, and Jody will also be doing that. And I will now pass you along to Jody for her to introduce herself.
Hi, everyone. Thanks so much to the Boxwood Alliance for having us here today. This is really a great opportunity for us to partner with such a great organization. What you're doing is wonderful to get information out about different topics, and we're here today to talk about knowing the 10 signs of Alzheimer's. I've been with the association for 5 years, and my role is community engagement. And what I do is work with different organizations. It could be a senior group, it could be a college, it could be a healthcare organization, and educate different topics as they relate to Alzheimer's. And it's a really great opportunity to meet individuals and to try to get the word out about what we do. All of our services are also free. We are employees, but our work is, we never charge for anything that we do. And it's a really great opportunity for us to just let people know what we do, because what Stacey does as a care consultant is really valuable, meeting with families for free, talking about what's happening, giving strategies in certain cases, or just general information. And that's what today's program is, basically general information, because as we get older, we sometimes wonder, you know, I walked into this room and why am I in here? What did I come in here for? We all have those moments where we forget and we're wondering, is that normal? Is that not normal? Should I be concerned about what's happening? And we know someone perhaps who may be thinking those things. So we're here to really go over knowing the 10 warning signs of Alzheimer's. So we're going to start with our program. And again, you know, feel free to use the chat feature, which we will you know, gladly go over any questions at the end. So we're going to go to the first slide here, and we're just going to mention quickly that we're going to talk in each slide. So as we go through the 10 warning signs, there's going to be an example of what one of the 10 warning signs would be, but then there's going to be a example of what a natural age-related memory loss could be. Because as we know, as we age, our whole body ages, our brain ages, and it's very natural to have memory loss that's not necessarily Alzheimer's or a type of dementia. So we're going to be recognizing the warning signs of Alzheimer's and dementia. Oh, did I do that? And we're going to kind of just go over everything. But in this first clip, we do meet a family who's communicating via text. So we can listen to that or watch that interaction. Okay, so this is an example of what perhaps could be the case, where there's a 73-year-old widow. She lives alone, and she's a retired teacher. She's always cared for her home, and she has 2 daughters. And these 2 daughters are going to be communicating about what's happening with their mom, and they're going to notice that maybe they've seen the laundry pile up, there's junk mail, newspapers all around the house, which is very unusual for her. Does that mean it's Alzheimer's? No. But that is one of the signs that things aren't the way that they normally would have been. So you can see this is how we communicate these days. This is our new world. This is how we discuss things. So the 2 sisters are communicating with each other, and they're saying they're worried about mom. She keeps losing things. The house is a mess. And her sister is saying it's probably normal to get a little forgetful with age. But the sister is saying it's just so unlike her. Should we worry? And then we happen to have a friend and neighbor who is a doctor, and we're going to hear from him now. And he's going to talk about, when to start worrying.
As we get older, cognitive problems become more noticeable for almost everybody, and it can vary from person to person. Typically with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names, and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently, and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
Okay. So now we're going to go on to our next slide here, where we're going to be listening to 3 different videos. And just as a quick introduction, being that we've been out in the community for all these years, meeting with so many groups, and even when we go through the slide at the end, we'll say, are there any questions? And most likely someone will raise their hand and say, what is the difference between Alzheimer's and dementia? It's just a very common question. Many times, even in the doctor's office, it's hard to grasp when a physician may say it might be a little bit of dementia or Alzheimer's, like what is the difference? So we're gonna go through this first before we go through the 10 signs. So what is dementia?
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So with that example, you can see that that big umbrella term, dementia, underneath that big umbrella term, and that umbrella term is a set of symptoms, including memory loss. And underneath that umbrella, Alzheimer's is about 70 to 80% of the cases. So when someone has Alzheimer's, that means they have dementia. But when someone has dementia, they may not necessarily have Alzheimer's. They may have the vascular dementia, which is maybe 10% of the cases. And then there's Lewy body, and then the frontal temporal dementia. And then there's many other types of dementias. So there's an importance of just knowing what the difference is. Because again, a lot of times when we're in the doctor's office, you know, there's not always a lot of time to go over that and explain that. So now we're going to hear about what Alzheimer's is.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
And now we're going to hear why it's important to know the 10 signs.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things. But when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor, to find out what you're dealing with.
So now we're going to go through the 10 signs. And the first one, which was already mentioned, is memory loss that disrupts daily life. Okay. So that's one of the key pieces here, because if someone has something called mild cognitive impairment, that means they're still able to go on in their day and get through their day-to-day activities. But when their memory loss disrupts their daily life, where they're unable to remember to take their medications, or they're unable to remember to go to their appointments through the day, or to remember or oriented, as to what day it is, just forgetting important dates and events, forgetting things that have recently learned, such as, today's Thursday, we have a program at 5 o'clock, or those sorts of things. Maybe asking the same question over and over again. What time are we going to the doctor? Those types of things happen very frequently with someone with Alzheimer's, because they're unable to remember those things that they've recently learned. And sometimes someone may start using memory aids to help them, maybe writing a note. Don't forget to close the garage door. Don't forget things that we've always been able to do, and maybe needing memory aids to make sure we don't forget them. A typical age-related change might be forgetting someone's name. We all have those moments where we say, oh my gosh, what is that person's name? That's very normal and natural, and that could progress as we get older. Forgetting that someone had an appointment. If I get a call that I missed my dentist appointment today, I don't say, I didn't have a dentist appointment today. I might say, oh my gosh, I made that appointment 6 months ago. I totally forgot. And that happens, and that's part of life, but it doesn't mean we necessarily have dementia. So there's kind of a difference there. And so now Stacey's going to talk about the second sign.
The next sign is challenges in planning or solving problems. So some people may experience changes in their ability to develop and follow a plan or work with numbers, which may result in maybe following a recipe. They've baked a banana bread all their life and they've just known how to do it, and now they can't remember how to do it, or can't follow the order of it, or driving someplace that they've driven a lot and now they can't remember how they've gotten there. Another one is difficulty concentrating and taking much longer to complete tasks. Typical age-related is making occasional errors. Maybe in managing your checkbook, you make an error. But if you're somebody who's always managed your checkbook to the penny, and all of a sudden you're not able to do that, that might be something you want to look at, versus if you're somebody who's never really done a good job managing your checkbook, then it fits right in with not doing a good job now or anytime. So there are differences in trying to figure out what seems unusual for yourself. So the next sign Jody will speak about.
Okay.
Oops, I think I went too far, sorry.
Okay. So the third sign is difficulty completing familiar tasks. And in this case, I don't know if anyone has ever read the book Still Alice by Lisa Genoa, or seen the movie. It's a really interesting movie where there's a college professor and she is disoriented and she goes for a run every day, and she's running and she forgets which way to turn in her run, that she runs the same route every day. So that would be something like, completing familiar tasks, which is her daily jogging route, driving to a familiar location, instead of maybe going to one location, going the wrong way. Now, we all have those moments, where we get in the car and we usually go this way, but we're going a different way today. But having that on a more normal, like on a regular basis, could present a problem. Organizing a grocery list, that might start presenting a problem, where the person really can't think of what they need to buy and have to, go open the refrigerator, where in the past they could just sit down and say, oh, I might need this, 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 and this. And now it might be a little bit more difficult. Might be, okay, let me think. What do I normally buy at the grocery store? And kind of going through and checking all those items instead of just kind of instantly knowing that that's something you need to buy. And another example would be remembering rules of favorite games. So if you're a card player and you know how to bid your hand, if you're a golf player, if you're playing maybe bowl, whatever it is that you're normally doing, you may start to struggle with the rules. It may become mahjong is a good example. That's not something that is so easy, and maybe that process is starting to take down, where you're really not comfortable with familiar tasks anymore, and they may take a longer time. A typical age-related change might be occasionally needing assistance with settings on a microwave, to record a television show. I mean, that's a totally different type of activity where maybe there's a lot of buttons, or maybe we forget because one room uses 2 remotes and the other room uses 1 remote, and it's just kind of getting overwhelming. That doesn't mean somebody has memory loss, but in the earlier examples, those types of things do happen, especially with the wandering piece. We know that 6 out of 10 people who with Alzheimer's will wander, either by foot or by car. And that means that they go out and they forget how to get home, or they get a little lost. So that's a very common sign, unfortunately, with this disease. And we're going to hear from the expert with relationship to this sign.
Some people have difficulty with math or with reading in a way that's unusual to them. And once again, this is a change in that person. So for example, we all know somebody who was never able to balance their checkbook, right? So that wouldn't be a warning sign for them. But if somebody who always balanced their checkbook to the penny suddenly was paying bills, the same bill over and over, and not able to balance their finances, well, that would be a sign for them.
Now we're going to go on to the fourth sign.
Confusion with time or place. So people living with Alzheimer's or other dementias can lose track of dates, seasons, and the passage of time. They may have trouble understanding something if it's not happening immediately, or they may forget where they are or how they got there. Sometimes you see that it's snowing outside and somebody's dressed for spring or summer weather because they've gotten confused. So you see some kinds of things like that. A typical age-related change would be getting confused about the day of the week, which happens to everybody, especially I think right now when we've been home and days are blending together, you know, but a typical age-related is that you can figure it out later or be reminded and then recall, oh yeah, that's right, on Tuesdays I do X, Y, and Z. Next sign.
So the next sign is trouble understanding visual images and spatial relationships. So for some people, having vision problems is a sign of dementia, which can lead to difficulty with balance, trouble reading, problems judging distances and determining color and contrast, which can cause issues with driving. And we also present to different police academies throughout the Hudson Valley, and we talk to police officers about the importance of knowing that someone may have memory loss and what that means, because many times we hear in our support groups that one of the first signs is that somebody is having a series of fender benders, maybe having difficulty driving, forgetting which pedal is for which purpose. It's a very common trouble, and the vision as well, seeing the stop sign. You know, obviously we all get into fender benders. Just because I may have a fender bender, that doesn't mean I have dementia. But again, this is a series of 10 things, and many times when we say these signs and symptoms, people will say, gee, you described my mom to a T. You know, all of these things have happened to her at one point or another. But not for everyone. We have a saying in the office, if you've seen one case of Alzheimer's, you've seen one case of Alzheimer's. So this is a generally speaking, you know, many times this is something that people struggle with. Again, that example of driving is really, I mean, the example of reading, where maybe not being able to recall all the things being the characters in the book, what was happening last time I was reading this novel. So that the vision can be impaired, and that is something to realize and be aware of. Now, a typical age-related change might be vision changes due to cataracts. So that's why, you know, we always encourage people to get to the doctor, because maybe they just have a change in their vision that's medical and can be, you know, fixed with proper care. So we're going to hear from the expert again here.
Alzheimer's disease is not just a disease of memory. It can affect other things too. It can affect the way that we perceive what we see. So sometimes somebody in the early stages of Alzheimer's might go to the eye doctor because they're having trouble seeing, and in fact, their vision is just fine, but the way they're perceiving what they're seeing may be difficult.
And now the sixth.
So the next sign is new problems with words in speaking or writing. People living with Alzheimer's may have trouble following or joining conversations. They may stop in the middle of the conversation and have no idea how to continue. They may repeat themselves over and over and not even realize that they're repeating themselves. They may struggle with vocabulary. sometimes somebody can't find the word for table, so they may just try to explain it by saying a flat surface or just using a different word. And just trouble naming familiar objects or using the wrong name. A lot of times also you'll find that if somebody's having so much trouble, they may just retreat a little bit and not join the conversations as much because they're self-conscious that they're not able to do it in the same way. A typical age-related change is having trouble finding the right word. I think we all have trouble finding the right word here and there, but this is really more persistent and happening more often where it's becoming something more noticeable. Oh, and we have Phil speaking here, and he'll speak about how this was a sign for him.
The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, you know, as an avid reader, as a reporter, as a writer. I struggle with them now.
Okay. And next is the seventh sign. The seventh sign is misplacing things and losing the ability to retrace our steps. So that's the key piece there, losing the ability to retrace our steps. So a person living with Alzheimer's may put things in an unusual place. They may lose things and be unable to go back and kind of put that detective cap on and say, you know, when's the last time I had my keys? Okay, they're not in the counter. Maybe they're in my bag. Maybe they're, you know, in my coat pocket. You know, kind of remembering a typical place that might be another option for finding that item. And with that comes sometimes accusing others of stealing. Because if I know that I always put my wallet on the corner of my desk every day before I go to bed, and now all of a sudden my wallet's not there, then somebody must have taken it. Someone must have moved my wallet. So those are types of examples with relationship to having one of the first signs, and that's a very common sign. You know, we all lose our keys, it's very normal, but to lose our keys and not be able to retrace our steps. Somebody with Alzheimer's may have put their keys in the fruit bowl. They may be tossed in the laundry. Very unusual places for somebody to put their keys. A typical age-related change might be misplacing things from time to time, but retracing our steps to find them. So sometimes we have a bad day, sometimes we have a bad week. It does happen where we lose things, but not every day. So now we're going to hear from our expert about this sign.
So some people wonder if, you know, if they lose their keys or their glasses or their purse, is that a sign of Alzheimer's? And one thing that I would say about that is for most of us, we might misplace something, but then if we retrace our steps, we can usually find it. We can usually remember. For a person with Alzheimer's, sometimes they're not able to retrace their steps. Sometimes that memory is just gone. And so when they do find their keys next to the phone because they got interrupted by a phone call when they were coming in, they set their keys down in an unusual space. So there they are next to the phone. If that happened to you or me, we'd probably remember, oh yeah, the phone was ringing when I came in the door. I put down my keys. The person with Alzheimer's might not remember. They might wonder who's moving their keys around because they never put their keys by the phone. So that's just a little bit of a difference in some of the dynamics with losing things in Alzheimer's.
The eighth sign is decreased or poor judgment. People living with Alzheimer's may experience changes in judgment or decision making. They may use poor judgment when dealing with money or pay less attention to grooming or keeping themselves clean. So an example is, I know I've gotten calls, phone scams, asking for money to wire to one place or another, but usually I'm well, always, I haven't paid yet. I'm able to use my judgment and say this doesn't sound right and hang up the phone. But a lot of times, if somebody is suffering from dementia or Alzheimer's, they're not necessarily using the best judgment and may think that something bad is happening and wire the money and get really cheated out of money for things like that. So that's an example of using poor judgment and not asking the right questions and kind of just going with it. A typical age-related change might be making a bad decision or mistake once in a while, like neglecting to change the oil in the car, just, just kind of not thinking about it and then realizing that, the car isn't working as well because they didn't change the oil. But nothing, it's just more of just neglect of something. We're going to listen to Teresa and how this was a sign for her.
The way I kept my house, I wouldn't say I was OCD, but pretty close to it. And all of a sudden, everything was okay with me. It's like, oh, it's a pile, I'm tired. So my dining room table usually looked like it was someone's office, because I always would say I would do it tomorrow. And then my bedroom, as far as clothing, I would just put it in a corner, put it in a chair. And all of this is just, I wouldn't say it looked like I was a pet wreck, but really I was, because I never threw anything away. I always would say, I'll get to it, but I never did get to it. So just the way of my standard of living, it was actually decreasing.
And now the ninth sign is withdrawal from work or social activities. So a person living with dementia may experience changes in the ability to hold or follow a conversation. And as a result of that, they may withdraw from hobbies, social activities, and other engagements. They may feel uncomfortable going into a social setting. First, they'll have to remember people's names. And then someone may come up to them and ask them a question, and they may realize that they're not going to know how to answer that. If someone comes up and says, hey, did you see the game last night? What did you think? You have to say, oh, there was a game last night? What, is it baseball? Was it football? Like, what game was it? And kind of recall the events from the evening before. If someone comes and says, how is your grandson doing? Did he graduate from college this year? And then you have to really remember, which grandson, who is it exactly that they're talking about? So those types of situations can become very awkward and uncomfortable and can cause a lot of frustration for the person who's experiencing the memory loss. And with typical age-related change, so, that's a little different where, obviously we all forget sometimes. Someone will say, oh, I'll see you tomorrow. And I'll say, well, what's tomorrow? I forget what day is which sometimes, but that doesn't, once they tell me, I'm understanding. And with the social engagement, sometimes as we age, we choose not to attend certain things. It's not that we have memory loss. We're just a little bit more selective. We may say, I don't really feel like going to that. So that's kind of the difference. And we're going to hear now from our expert who explains this, because again, sometimes people really understand that they're, being affected by memory loss, and then others, may not really realize it at all.
One of the most common changes, and early on, is the person's comfort zone shrinks a little bit, and then that gets worse throughout the course of the illness. So they're less comfortable going out, they're less motivated to do things than they were in the past. So there's some change in day-to-day functioning that way. I think people also lose confidence in their cognitive abilities, because they may not recognize someone or know their name or find the right word, and they'll feel awkward, and they don't want people to notice that, so they feel more comfortable at home or in situations with family where they're very, very comfortable with that wouldn't concern them. So people tend to withdraw a little bit and be less outgoing. That's can be one of the early signs of Alzheimer's.
So the 10th sign is changes in mood and personality. People living with dementia may experience mood and personality changes, such as becoming confused, suspicious, depressed, fearful, or anxious, or getting easily upset at home with friends or when out of their comfort zone. So as we mentioned in some of the earlier signs, for example, if you put your wallet someplace different and you can't find it, and becoming more suspicious and saying somebody stole it, it's very confusing when you're not remembering things or being able to recall things, or it could be very, anxiety provoking to not know how to do something that you knew how to do, or losing your words when you know that it's happening more often. And it's getting easily upset at home when you're out of your comfort zone and doing different things because you're having a different result than you used to in terms of being able to have conversations or whatnot. So typical age-related change is developing very specific ways of doing things and becoming irritable when routine is disrupted. So maybe, as someone ages and they're so used to always eating dinner at 6, and then they're out with the family and the family says, oh, dinner tonight is at 8:30, and just becoming irritable. I always do it at 6. That's how I do it. And that could just be very typical age-related, just being in your routine, doing it for so many years and being very comfortable with it, as opposed to like a different level of fear or anxiety when you're not doing it the way you always have done it. And we're going to hear from our expert.
Another early sign of Alzheimer's or dementia is subtle changes in behavior. So all of a sudden, the family may notice the person is more easily irritated, or more impatient, or a little moody, or have a shorter fuse, or more anxious. Now, there's lots of things that can cause that, but often that can be an early symptom of Alzheimer's or go along with the early symptoms of memory loss.
So those are the 10 signs of Alzheimer's that we wanted to go over with you today. Just to mention, so it's so important to realize that these are the 10 signs of Alzheimer's, and this is really an opportunity when someone may present with maybe a combination of some of these to really go to the doctor. We don't ever encourage anyone to self-diagnose, because we know at the association that many times these 10 signs can be caused by something else. There are other things that can cause dementia-like symptoms which are reversible. Someone may be taking a medication. Somebody may have a problem with their hearing. Somebody may have an infection. Someone may have a problem with their thyroid or a vitamin deficiency. So whenever we present these, we always encourage someone to go and get a well visit. And through Medicare now, Medicare will cover a cognitive assessment for free. It's a billable piece for the physician to Medicare, and it's a great opportunity for the patient to get a baseline of what's happening. And along with that, starting with general blood work and getting a feel for what else could be going on, because many times it could be something else. So we always want to encourage people to realize that as well, as many times, someone may have some troubles. Somebody could be depressed, and maybe once whatever it is diagnosed, could go back to their normal self. So we just want to say that these are, again, generally speaking, 10 signs for someone in the early stages. We meet with a lot of caregivers, a lot of families. In Westchester, we have a lot of support groups. We have Stacey's an amazing support group facilitator, and meets with a lot of families and a lot of people also who are in the early stages. And we have a group that meets specifically for that purpose. And everyone in that group has an early stage of some sort of dementia, whether it's Alzheimer's or Lewy body or vascular. We're an organization called the Alzheimer's Association, but we also assist anyone who's suffering with memory loss. So we just, want people to know that we're here for them. if they know of a family member who's, either already knows someone with this disease or may be concerned, that we have a lot of free services, whether it's through our 1-800 number or with one of our care consultants, where we can meet with someone, kind of strategize about what's happening, and kind of make a plan for moving forward. So with that, I know we've been talking for a while, and I don't know if there's any questions in the chat, but if there are, we could certainly open that up.
Okay, so yeah, I think if anybody has any questions, you can raise your hand and I can unmute you and allow you to ask a question. If you feel like putting it in the little chat or the Q&A, I'll give everybody a moment to possibly do that, and then we can go from there.
I just put my name also in the chat and the 800 number if anybody ever needs to call. It is a 24-hour number. It's a helpline, so if anyone's struggling and it's 2 a.m. or stressed out about something that they're dealing with a loved one or themselves, they can call the helpline. And you'll speak with someone at the helpline, and if you want to speak with someone locally, they'll get you to me or another colleague locally for the next day if it's
I have a friend with whom I speak on a regular basis about this sort of thing. Are there different rates of deterioration, or some people that are more likely to develop these things or than others? Is there any kind of profile? I don't know anything in comparison to many. I'm really curious. I'd like to know more.
So you asked, are there different rates of how this progresses and also different profile? So different rates, that there are people, some people can stay at a level of like mild cognitive impairment for many, many years and go on for many years. And some people show signs of that and deteriorate very quickly. And it, as Jody said, if you've seen one person with Alzheimer's, you've seen one person with Alzheimer's. It really is different for each person. It's part of what makes this disease so difficult is just it's very unpredictable in terms of how it's going to be for that person. I mean, there are certain hallmarks like these 10 signs to look for, but each person is so different. And some people are going to lose some things and before they lose other parts, depending on which part of their brain the disease travels to and in what order and how fast. So it really is different for each person. In terms of a profile, I mean, the biggest risk factor in the profile is age. So I don't know, Jody might have some statistics and readily available in her head, but the older you are, the higher chance of having Alzheimer's. But there are people who get it younger, and there are some genetic components, and there are studies and scientists figuring out all of that right now and trying to find out if there are biomarkers or lifestyle, you know, they're trying to connect, is there something with high blood pressure? There's so many studies trying to figure out what the profile is of a person. I mean, there's certainly some ethnicities and races. Women suffer more from Alzheimer's. African American people and Hispanic people have higher rates of Alzheimer's, but we don't know why. So there's a lot of studies going on, and there's really no real set cookie cutter way to predict. You could have parents that have Alzheimer's and not get it, but it is, genetics do weigh into it. I don't know if that answered your question because it doesn't really give a real good answer.
No, actually, that was a better answer even than I actually expected. I didn't realize there were that many different factors that could or might not affect you. So it sounds pretty random. Not that there aren't groups. I did a little reading, and I know there are certain groups, certain places, things like that, where there seems to be overwhelming genetic evidence of the development of the condition sooner rather than later. But other than those little pockets here and there where there's, you know, some purity of strain or something like that, that it's easier to trace, that it doesn't, throughout the rest of the population, it's almost anybody's guess, but it seems to be more of us all the time. So thank you very much.
Thank you so much. We have another question, so I'm going to mute you back, and then I'm going to all right. Carolyn, I believe you're unmuted if you want to ask a question.
My question has to do with accessing help through the Alzheimer's Association. Do you always need to go through the 800 number? And what is that process like? You know, the caregivers, you know, they want help when they want help, and they don't want to have to go through a whole red tape, bureaucratic way of getting help. So what is the best way to process? Can they call the local office directly, or do they have to go through the 800 number?
I can give you my answer. Mine might be a little bit different from Stacey's because I don't, you know, a lot of the times we do encourage people to use our 1-800 number. And I'll tell you, the main reason is that we're not always able to answer the phone, and we know that caregivers usually want to talk to a live person right away. So the best thing to do is to call the 1-800 number, but it's not the only way. You know, when you do call that number, you will get a return phone call from someone. You can ask for a return call from the care consultant within your area. So if you're in Westchester, you'll say, you know, you want somebody from the purchase office to get in touch with you. But we also have online chats, you know, where you can chat instantly and get instant feedback as well. And then if you have a relationship with a care consultant already and say, this is my opinion, because Stacey's the care consultant, so she should really be answering this, but so I'll stop talking. But like if you've already spoken with someone, then you don't have to go through the 1-800 number again. You could maybe perhaps reach out to that person via their email or their phone direct line.
Jody, that's exactly what I would have said. I mean, people oftentimes start with the 800 number with me, but I run caregiver support groups. I run early stage groups for people with dementia, and I run social programs. And so there are families and people I just have relationships with at this point because I've seen them, they've seen me, and they're not going through the 800 number. They've got my number in their back pocket. But like Jody said, you know, a lot of times I'm at a program or in a meeting and somebody wants to speak with someone right then, or I could be on vacation for the week and you don't want to wait for me to be back after a week. You can get to somebody 24/7 on the helpline, but you can always get it. You will go through that first if you call the 800 number, but it doesn't mean it's a hard process to get to me or my colleague Joe Nimmo, who does what I do in purchase. We literally get, you know, something in our email like instantaneously to call you, and we will call you, you know, our next available time in the office, which is always within 48 hours. So that's why we say go through the 800 number first, because you don't have to wait any time.
We have a program called the Community Resource Finder. So if you call our 1-800 number, it dials into a call center in Chicago, and they have access to the Community Resource Finder. You have access to the Community Resource Finder. It's in partnership with AARP, and you can find out, say you're just looking for a support group. You can find that out instantaneously. Like Stacey was saying, what if she's on vacation for a week and you miss that next meeting, which is like in 2 days? You know, so this way you get an instant answer that, oh, there's a support group at 10 o'clock on Thursday, and you can attend that because, you know, you have a quick turnaround.
Thank you, that was helpful.
Thank you. So I just want to thank you both for presenting. You guys did a great job. This was really super informative and super helpful, and I hope those that attended found it to be helpful as well. We can and will, if you'd like, if we have your email, which I think we do have everybody's email actually from the registration, send out, I did not do it in advance, but we can send out the information that they've provided with us so everybody can have that information. So if there's not any other questions, I think that we will close out this webinar unless anybody has anything else to say before I do that. No?
Thanks for having us.
Thank you so much. It was really wonderful, and we do appreciate your time, and thank you everybody for coming and listening to us. Thank you.
Thank you, ladies.
Okay.
Thank you.
All right.
Bye.
Bye.
Bye-bye.